I'm Tori. I'm a parent of a teenage son with Asperger's.
Yeah, I'm John Cosmo. I'm the father.
Hi, I'm Agnes Feliciano. I'm the mother of...
My name's Christine Meredith.
My name's Dr. Paul Phillips.
I'm Cheryl.
My name's Peter Duffy. I'm a parent. We have 4 boys. The eldest and the youngest both have Asperger's.
We are Mr. and Mrs. Moodley, and we have 2 boys.
When he was about 2.5, we noticed that my son was not socializing and has no language, like he has his own language, and we're concerned about him. And he just played by himself, and he was obsessed with wheels, like cars and trains. And so I mentioned it to my friend, because we were just new migrants in Australia, and she mentioned to me that I could bring him in the Burwood, because there's a children's center there that could help us. So when I mentioned it to them, John was assessed, and they scheduled us to see Dr. Pollack, who assessed John, and that's when John was diagnosed to be autistic.
My wife noticed when Thomas was only a baby, the sudden increases in temperature for no reason at all. There's quite a few things. She was a bit more observant. I was like the sins of the father, just saying, oh, he'll be okay, everything will be fine, this will be okay. Even as he was growing up and he started organising things, had to have the full set of something, like Thomas the Tank Engine books or the Thomas the Tank Engine set, or dinosaurs. There was another one, Transformers, I think, was another one. Had to have the full set, would not stop till he had that. There was like an obsessive behaviour. I probably noticed more so when he was when I had to coach him in soccer, and his coordination just wasn't there. No matter what I tried, the coordination wouldn't come in, but his social skills with the kids weren't like the rest of the kids' social skills.
So I've got 3 children. Both sons are on the autistic spectrum, disordered autistic spectrum. The elders seem to go through school without say slip through the cracks like I did at school. He's similar to me with high intellect, but he has problems communicating. And my youngest son has a lower IQ, and he had a lot of problems at school, behavioural problems, because he's got the hyperactivity that boys often have with autism. We called him the wonder child. You're always wondering what he was going to do next. You just couldn't relax.
I would say that I knew he was different from the very beginning, from a very small baby. He seemed like his nervous system was raw, and sounds, lights, people coming in and out of the room caused him physical pain, and he seemed like everything was overwhelming to him. But he also loved routine and was quite easy to settle into a routine.
As a parent, I suspected, probably from the age of 18 months, that my son was having difficulties and wasn't quite like every other child of his age. He wasn't babbling. He wasn't socially interacting at all, like a normal child of that age. They're usually, fairly active and wanting to babble and talk and make eye contact. He was very intelligent, but which had me quite puzzled at that particular time because he was doing puzzles of 3 and a 4-year-old would be doing, very complex puzzles. And I thought, but he still wasn't socially interacting. He used to do a lot of head banging, very poor fine and gross motor skills. So I became really concerned when he was 2, and then I sought professional help.
We both, with our first child, we realised he was different when he was about 2 or 3 years old. We have a lot of nieces and nephews, and we thought we were bad parents, so we went to parenting classes. Then later on, we was diagnosed with autism, and then finally, after a lot of years, he was diagnosed with Asperger's.
We noticed a difference in Nathan when he was probably about a year old. Prior to the year, he was hitting all the milestones. He was talking well. He was making eye contact, and everything was fine. And there's something happened after the year. He was even saying "dad" and "da" and whatever, that sort of thing. And after the year mark was when there became a reversal, which is very interesting. We still couldn't fathom after that.
I suppose the first hint was when he was about 2.5, 3. It's about 2.5, just before he was 3 actually, when he ran home from preschool, which would be a distance of about 3 k's, 2 k's. It's between 2 and 3 k's, on his own, and got into the house and told me that his mum knew that that he was just running ahead of us. I thought literally she was just coming up the steps, and he didn't see anything wrong with it. He didn't perceive any danger or naughtiness. There was no connection between what he'd done and why his mum and I might be upset or distressed or worried. He just couldn't see any connection at all. That was probably the very, very first sign that something was a bit different. He just couldn't get why mum might be upset, and why I might be upset that he told me mum knew he'd run, even to the point where we had to call the police to find out what had happened and where he'd been, etc. That would probably be the very first thing that he ever did that was a bit different.
We started off with OT because before he was diagnosed we were addressing his sensory issues. So he had an OT that worked with him a couple of times a week for maybe half an hour. Then we moved on to the Autism Association at the time had Building Blocks program. So he went to a preschool with special needs support and an aide, did building blocks, did transition to school, and was lucky to go to a primary school that accepted a lot of the interventions from the Autism Association and specialist teachers.
First of all, Jan was already booked that somebody from the Autistic Association went to our house once a week to have therapy. Sometimes they bring Jan outside, and Jan was provided with a speech therapy every week too. And from then on, we were guided when Jan was about to start in school, in preschool, and he was also placed in a preschool in Ashfield, where it happens that they cater also to children with special needs.
Once we actually were confirmed with a diagnosis, we were advised to seek speech therapy. This would help him with his language and communication skills and also some of the social deficit that he was experiencing. We had to, for fine and gross motor, go to have regular visits twice a week with an occupational therapist. We were doing the prompt method for communicating, in basically working on low muscle tone, in He was also tactile defensive, which meant he was very sensitive to certain stimuli, as far as sensory stimuli. It may be he was very sensitive to the touch of wool or somebody rubbing his arm or cuddles. He would refuse to cuddles. And he was almost like he lived in a bubble, a world of his own. And that was very difficult as a parent to deal with because I was already working in disabilities. And I started thinking maybe there's more than one comorbid disorder or disability here because it was so complex. There was another disability, it was ADHD, and he also has dyspraxia. So it was quite a little nest egg to deal with. But I found the overlap between those comorbid disorders. It was very, very difficult to define the line where one started and one stopped, because there are some common characteristics between all of those spectra.
Therapy-wise, we've used occupational therapy, we've used speech therapy, we've used some sensory integration therapy. However, some of them seem to work short-term. The sensory integration didn't really work for him at all. He didn't like it. The occupational therapy, he liked the occupational therapist. The occupational therapy itself seemed to work to some extent. I'm not sure how much it worked. The speech therapy worked to some extent. His speech did slow. He stopped slurring his words and he stopped talking with a fixed jaw.
If I think about it, you have to really work with them. You have to find out what motivates them to learn, and if you can find that, they're basically, well, not putty in your hands, but they're close to it, because you can work with them and use their gifts to grow them into something that is very useful to themselves and in everyday society. They don't generalise. If you tell them to come in and they want to know what to do every day you've got to tell them to take their pens and pencils out and put on the desk. And it only after years and years it will then become a habit that they've got to unpack every day. They seem to stress out, and all their senses, all 5 of their senses, are a lot different to everybody else's. I won't call them normal people because I don't believe there's too many of them in the world, but their senses are very sensitive. So most Asperger's children, when they're growing up, especially when they're young, they need somewhere for time out or somewhere to go, to be quiet. They need to know if they're broken down because of the noise in class, they can walk outside and sit in a chair in the hallway until they're calm again and come back in, or go to the teacher's office or something like that.
One negative criticism, he needs at least 7 compliments to get back to square one. I suppose that's why I take 1 step forward and 2 steps back, don't I, Tom? But we sit there and we listen to him, that where he makes choices, if we discuss those choices, not just tell him that's a bad choice, but say, well, if this is your choice, what are going to be the consequences? Which way are you going to go? If that's the choice you make, if that's the path you take, and these obstacles are in front of you there, you've got to take other paths to get further ahead. So I think rather than say, like Chris said, rather than say this is wrong, try to show him the paths he can take. That was one of the biggest things that I picked up on.
Okay, well, with the as far as teachers go, with our experience that we've had, is we found that if there was a patience seems to overcome a lot of things, and the other thing is the knowledge of the actual disorder, the autism spectrum. When you've got the knowledge of it, it helps in actually managing the child better, or the student better. And the other one was just empathy. we find that with the empathy part of it, it's almost like try to put yourself in that child's shoe, and to understand that child, and also like, you know, knowing that this child has already got a problem, you sort of try to come down to that level rather than the level that you are in. And I suppose that would come under the education part of it, educating teachers a little more on the actual disorder, as per se, in an overall environment where you've got normal kids. With the spectrum disorder, it's a little bit more complicated because you've got them from A to Z, and they could fall anywhere on the spectrum. So patience, empathy, and knowledge, I'd say, is the three key ingredients as to assisting autistic kids.
Through primary school, he continued to have his aid time, which wasn't very much, but there was an aide for part of the day in the room for him and other children. He didn't need a lot of support from year 1 to year 6, and we were probably just very lucky to have very skilled staff in a mainstream setting. He would explode at home after transitions and stress during the day.
The most important thing for teachers to understand with a student that has Asperger's or who is on the autistic spectrum would be that they are all different. Their needs and wants are all different. They need extra time to perform and complete tasks. They need to learn how to socially interact appropriately. They need someone to understand when they have a behaviour outburst that is beyond their control and they haven't learned the skills and how to modify or control their behaviour. I think they need to understand that they are really intelligent and not to classify them as dumb because they can't always show their ability. I think they need lots of patience and understanding, and probably more than anything, I think they need whoever's instructing or teaching to understand the disorder itself before they attempt to modify or change that student in the way they perform. Yeah. They are super sensitive, and often that super sensitivity is difficult to relate to somebody else as to why they're feeling that way or why they're becoming anxious. They like structure and routine. They like to know well before in advance when something's going to happen and why it's going to happen so that they can adjust to that change to reduce the anxiety. They need to peer up with somebody that's capable of giving them patience and understanding as well as far as a peer, because they don't make friends at school, they don't make friends at high school or in tertiary education. And it's that isolation that often causes them more anguish than the learning itself.
Yeah, I want teachers to know that children with autism are of different range. They are not the same. They're different range, and that's why really it's better to cater to them like one-to-one and to know like what really their needs are, because they have different behavioral problems, and like because every child needs a different therapy. Yeah.
I think one of the biggest things different from my son is the over-application of a rule. This was most obvious to me when we were up at Cardiff Court one day, and he saw a number plate, and the number plate was DRA something something something, and it was just a normal number plate. It wasn't a special number plate, and he said, "Oh, that's Dr. A's car." And of course, it took me a while to get what he meant. Was he saw the DR as in the shortened doctor and A as in shortening of a surname. So he actually thought that meant on any normal car that DR always meant doctor for it. And I think that's one of the things that teachers sometimes forget, is that because of the fixed thinking, the fixed rule application and the absence of context change, that sometimes the child may seem as though they're being naughty, rude, dim, or just belligerent, but actually it's because they can't shift rule sets. And this causes them a lot of distress, because if they think they're operating by the rule that's right and you're telling them what they're doing is wrong and they don't get the reason why it's wrong is because the rule has changed, it would be incredibly anxiety provoking for them as a child because they want to please, they want to do the right thing, but they just don't know how. So I think one of the most important things is to make sure what is implicit is expressed explicitly with the child. So actually asking them, what rule are you using, what are you thinking right now, if they can do that metacognition, and finding out, and when you find out what the rule is, what you'll find, and what I've found as being a parent, is they're following their rule. The problem is not that they're following the rule, the problem is the rule itself is being applied in the wrong context. And once you can give them a new rule, they can shift. The problem is they can't self-generate that new rule.
With John, I can see with his future that with the right guidance, I can see John that because he's really interested in hospitality, he will be good in that area, because it's not only hospitality. One of his interests is cleaning, and if it were together, like he even told me that he wants to have his own cafe. Yeah, that's why I'm planning that after this course, we might like go to the right channels where John could start like working first, and then to see how he goes, and where he could like show his skills better, and also like because of his behavior, where his stress levels, because he has this adjustment from teenager to adulthood. So as of now, John has a doctor that also guides us what's best for John. I can see in the future that maybe John would be a good in hospitality.
For the future, we're looking at having him be supported by a clinical psychologist that will support him with the main issues of self-esteem and managing anxiety and managing his time, but also work with the staff so that they are better able to understand him and support him.
Depends what day of the week it is for him. Some days of the week he's definitely never going to be able to become a dad because he doesn't like responsibility. He has 2 dogs that he has to look after, and he doesn't like the fact that he has to look after them whether he feels like it or not. So from that, he's inferring he's not sure if he wants to be a dad because he realises that dad doesn't always want to look after the kids, but being a good dad means you have to, whether you want to or not. So in some ways he's saying he doesn't want to be a dad, but he may want to be married, which is great. So I see for him future, it will be a struggle for him socially, and if he does have a permanent relationship like a marriage or something similar, it will always be a bit of a struggle for him, and I suppose that's an ongoing hardship he will have to live with well after I'm gone, but hopefully we can help him understand it as best as we can.
Support. I think anyone on the autistic spectrum, as far as Asperger's, can achieve great things in life, provided they have someone that's going to mentor them and bring out their best, increase their strengths, allow them to take risks, safe risks, and always achieve the highest possible goal for themselves. Often they'll sit in a bubble and they say, okay, because I have a disability, I'm never going to amount to anything. I can't achieve what other people can achieve. I can't do what they can do. I'm stupid. And that's definitely not the case with somebody that has Asperger's. They are super intelligent people. It's just a matter of getting that diamond in the rough, polishing it up, steering it in the right direction and allow it to bloom. Because it's so satisfying seeing someone that has no idea that they've got a future and then suddenly unfold those onion peels and say, wow, look at them, look at this person, what they're capable of achieving. And I believe probably some of the best people in society today have Asperger's. So give them every opportunity to take a risk, to rise to a challenge, and you have to actually coach them into enabling them to do that. Give them lots of self-support strategies so that they don't have to ask other people for help all the time, and they can start to believe in their own ability of solving problems themselves. Allow them to believe in their strengths and play down their weaknesses, because the weaknesses aren't as important as a strength, because it's the strength that's going to build up their self-confidence, build up their self-esteem and make them feel worthy.
One of my biggest fears is that Thomas is locked into one. He wants one outcome, and that's it. And because he has limited his horizons, I don't see his future great in that. That horizon is limited. It's like narrowed his path, and I think it's got to be widened a bit. Nothing wrong with the decision he's made, but I think the decision has to be an open one, not a closed one.
I think if they get the right amount of intervention, and I think that we've proved it with our eldest, who they said would probably stay at home all the time and go nowhere with life or with his life, that if they get the right amount of intervention and coping, and that goes with home as much as it does school, but as a young age, school's got them more than what their parents do. So with the right amount of coaching, they can be moulded or they can be taught as good, if not better, than anybody else. And with their gifts, their memory recalls and stuff like that, that you can, they can grow to be anything they aspire to be. Thank you.